Hello, I'm here today with Rose Maruru and Adwoa Agyeman, who are the co-directors of EpicAfrica based in Dakar, Senegal. And this is part of a series of conversations that we're having with friends from the African continent who are in the civil society sector about the impacts of COVID-19 on civil society organizations in Africa. And very excited to have the two of you here because you've recently completed a survey of 1,015 African civil society organizations across 45 countries. So one, congratulations, because that's a great achievement. You've done it very rapidly. So we wanted to learn more about your work and the results of the survey, but I wanted to start first of all by just hearing a little bit more about you and EpicAfrica.
EpicAfrica is a Senegal-based non-profit organization that was co-founded by Adwoa Agyeman and myself back in 2015. Adwoa and I had previous to that, worked at a grant-making foundation that's also based here in Senegal. And she worked as the grants manager and I was the director for operations. And we kind of, were in this space that sort of straddles all the legs of an organization. So we saw a bit of what's happening with the program, what's happening with the grant making, what's happening with the grantees, what's happening with finances, strategy. And we're really able to see how the organizational capacity side of groups, particularly the grantees that we were working with, was often not, little attention was paid to that. A lot of the focus, rightly so, goes to programs. So there are a lot of program strategy meetings, lots of thinking about what should we do, how do we solve this problem, but very little attention about how do we build an institution that will actually do that work.
So Adwoa, I'd be very interested to hear more about the survey that you carried out recently related to African civil society organizations' experiences with COVID-19 and how that's affecting their organizations, their operations. Can you tell us more about why you undertook this survey in the first place, why you thought it was important to do now, and what you were hoping to achieve?
We first started off with a Twitter chat in early April, and that was an opportunity for CSOs across the continent and other stakeholders to really come together to really air their views as to how they were coping with COVID-19. And we really got into the spirit of wanting to continue to document the experiences of African CSOs, and really had the opportunity to do this through a partnership with David Barnard from At Africans NGO, where we came together to join forces to do this mapping and to devise this survey. We had over 1,000 CSOs respond to the survey from over 45 countries.
Rose, I want to turn back to you and hear a little bit more about some of the results. How about if we start with what you found most surprising?
So two big surprises for us. We knew there was impact. We knew it was bad, but we didn't really have an idea of the magnitude of it. And it turns out that 98% of the respondents said they had had COVID had some impact on them. We know that some, about 60, going on to 70%, either reduced their activities or had to cancel operations altogether. Particularly groups that deliver services, like the facility-based service delivery organizations, where people could not come. They didn't know how to protect even their staff, so they just closed down. But the second real big surprise, which is sort of the other side of the story, is just the agility and adaptability and innovation that we're seeing in the space. So even those that moved offline, and there's a good example that Adwoa and Adwoa knows, called Imagination Africa, which is a facility-based service provider. They cater to young children, so children come to play and they have all kinds of, activities, like kind of museum. And, so how do you continue to operate? But they have moved online and started to actually offer services like, they've been having a series of programs on TV and else and on social media, like just having children ask psychologists questions, because we're not even thinking what's happening to children. There are all these issues, right? As we worry about the medical and the economic collapse, like what's the impact on actual human beings, especially the small ones? How are they processing this and how is it going to affect them? So we're really, really impressed by just the creativity that we're seeing in the sector.
We did this landmark study that we circulated at the beginning of this year. And one of the things that has been so striking, because at the end of that survey, we asked CSOs across the continent at that time, what do you want funders to know? And some of the things that were mentioned then about reimagining capacity building, localization, for funders to be more patient, to be more humble, for there to be more transparency on their part, and for them to be able to do more to also shore up their own sustainability in partnership with funders. I find it fascinating how in this survey, we're seeing very similar things being discussed. And I think that we're at a time which is really critical and an opportunity for a lot of those things which were mentioned maybe as more sort of like pie in the sky. No, actually, we have to think about localization. We've got to think about how do we get more resources generated locally? How do we think about our own sustainability? And so it's a really pivotal time, and I think there's many opportunities to maybe do things a little bit differently than how they have been done in the past.
This has sparked partnerships and people working together in a way we haven't seen before, where the sector is very fragmented, very siloed, but we saw groups are coming together to exchange resources, to put build campaigns together and that sort of thing. So we hope that this momentum, that this won't just be an emergency response, but it actually becomes, they see the value of doing that, both as an individually as well as the collective sector.
In the US and elsewhere, we're becoming very aware of how COVID-19 is amplifying pre-existing inequalities. Do you have any observations about how this is playing out in Africa?
On the ground, we've been able to see how these measures that government put in certain countries, some more restrictive than others, to safeguard populations have had real impact on, of course, inequality on this continent.
This is one time that Africa was a country because they all kind of did the same thing, right? Curfews, you can't move across regions, no flights from overseas, etc. And the middle classes of this continent are very fine with that. I can work from home. The only complaint, oh, the kids are home, but the woman who sells vegetables around my corner, who can't eat dinner if she doesn't sell her vegetables, this afternoon, she doesn't have many options to work from home. And if we believe in numbers that majority of people, certainly in the urban areas, are in the informal sector, they eke a living, a daily living. You have to get up and go and earn your, 2,000 sefa so that you can have dinner and the family can have dinner. So it's really challenging, and I'm not seeing really enough sort of interrogation of like what's really happening to people. The story we keep hearing every day, the Minister of Health of every African country comes at 10 o'clock in the morning and reads how many people have been tested, how many are sick. We hear nothing, nothing about how are people actually living this situation. We imagine it's very difficult, and the reason why, in fact, governments didn't move to do the kind of lockdowns we saw in the West was recognizing that there's going to be social unrest.
Describe a little bit some of the recommendations that you have for funders.
Just to provide unrestricted funding through, whatever mechanisms exist to enable CSOs to pivot and address the issues that really are at the fore right now. The average length of, a typical grant to an African CSO is 18 months. And it's often, project restricted. Now, if you imagine that, you have an 18-month, grant, it means a lot of things for a CSO. It means that you're not going to be able to attract the best talent because, no one's likely to leave a job for a job that has no, sort of security. You're not going to be able to do, to have a great website. You're not going to be able to have a communications officer to tell you a story. And we know it's so important to tell you a story from both a fundraising point of view, but also in terms of your legitimacy, because one of the things that we hear, ordinary Africans and our governments complaining about civil society is like, what do they really do? Like, what difference are they making? So really being able to tell you a story, and those are all considered by most foundations and most funders as quote unquote overhead. So it doesn't get funded. Everybody wants just a project that's going to change the situation of women or whatever, but, not really looking at what does it take to do that, not from programmatically, but, organizationally, what does it take to do that? So I think there's a real opportunity now for funders to really seriously rethink and really interrogate their approach to grant making to this sector and make some bold moves. And like I said, it's risky because it's never been done. But I don't think there's, I think it's a moment. I think it's really a moment.